Let's now talk about malaria. The government is planning to roll out a mass malaria vaccination exercise in malaria-prone counties in a move aimed at curtailing the spread of the mosquito-borne disease. This follows an upsurge of malaria cases and the discovery of a new invasive mosquito species in Marsabit County. As Gloria Milimu now reports, experts are now calling for strengthening of surveillance in a bid to protect progress made in the fight against the disease. Take a look.
In what now seems to be a move to stop the mosquito-borne disease in its tracks, the government, through the Ministry of Health, plans to inoculate children under the age of 2 in the 8 malaria-prone counties using the world's first ever malaria vaccine, RTSS. The exercise that will be carried out through the National Vaccine and Immunization Program will commence in 2 weeks' time, according to the Ministry of Health.
The vaccine is given in 4 doses, of course, in children, targeting children below 3 years. So you start the first dose at around 6 months, then the second dose at 7, the third dose at 9 months, and then the fourth dose at 24 months.
Targeted counties include Bungoma, Vihiga, Kakamega, Siaya, Homa Bay, Kisumu, Migori, and Busia. The government says the RTSS vaccine, which was piloted in Kenya, Malawi, and Ghana in 2021, has helped reduce the incidence of malaria among children under the age of 5.
We've already tested the first 3 doses because as you longitudinally track these children, then so far much of the data that we are getting in terms of the buy-in, the accessibility is within the first 3 doses. But again, as these children continue to grow, then we'll see actually how the fourth dose, the uptake of the fourth dose will actually mean in terms of impact and take of that interventions.
As the government plans to enhance the fight against the disease, experts advise the need to also monitor other regions, considering the notable changes in transmission patterns and dynamics being witnessed in seasonal malaria areas like counties in the north. Counties like Marsabit, where a new invasive mosquito species, Anopheles stephensi, has been detected, and also Turkana County are among counties reporting cases similar to what you'd see in malaria endemic regions. For instance, Turkana County is said to have reported malaria parasite prevalence rates of more than 10%, similar to counties like Busia and Siaya, ranked among the high-burden counties.
Previously, the northern part of Kenya was considered a seasonal malaria area, and what this means is that, yes, we could see bouts of malaria, okay, of course, attributed to rainfalls, if there were extreme temperatures and so forth and so on. And that is why the interventions that were put in those particular areas were basically aimed to address those particular climatic situations that will actually arise at a given point in time.
Malaria experts attribute this upsurge to various factors, including climate change, which has been a standard contributor to malaria transmission, and vector parasites, which basically thrive within a specific environment.
There are some other human factors that can also contribute, migration, movements, and so forth, that can actually move mosquitoes from one particular region to another.
Similarly, the World Health Organization has warned of an upsurge in mosquito-borne diseases due to global warming. Even so, detection of some of these diseases like chikungunya, Zika, and dengue fever remain a challenge in the country due to the diagnostic capacity. Nationally, the prevalence rate of malaria has reduced from 8% to 6%, with high-burden areas experiencing a reduction of up to 10% from an initial 29%. Gloria Milimu, KTN News.
Let's now head to Taita Taveta, where residents are finding